My name is Alice Wickersham and I'm a researcher at the CAMHS Digital Lab at King's College London. My CRIS research focuses on child and adolescent mental health and particularly its relationship with educational outcomes. One of the really important aspects of CRIS is our ability to link our mental health records with other de-identified datasets. So for example, some of our child and adolescent mental health service records have been linked to educational data from the Department for Education using a secure and confidential model that we have developed. And we've done this so that we can look at the relationship between mental health and education. We've done some research that shows that children and adolescents who receive a depression diagnosis sometime before their 18th birthday tend to perform at sort of average or even sometimes slightly above average levels in primary school. But then they actually often show quite a substantial decline in their school performance during their GCSEs. Another way of thinking about this is we've found that pupils who receive a depression diagnosis before age 15 are 40% less likely to achieve 5 A-star to C grades, including English and Maths at GCSE, compared to pupils that don't have a depression diagnosis. So you're seeing a real kind of loss of academic potential in this group. So the reason that this finding is really useful to us is because it motivates us to think about what pupils need to get that extra support to help them complete their compulsory education. Since the project, we've actually done more work to find out more about the young people who are accessing our child and adolescent mental health services with a depression diagnosis. And what we found is that the majority of this group receive their referral and their diagnosis between the ages of 15 and 18, which is of course around the time that many of these young people will be sitting their GCSEs. Some other NHS trusts have similar systems to CRIS in place for accessing their health records for research as well. So that finding is something that we've actually been able to replicate in Cambridgeshire and Peterborough NHS Foundation Trust as well. So we know this isn't something that's just limited to our local area. That trust has also just recently completed their own linkage between their mental health records and Department for Education data. So going forward, we can start looking at regional similarities and differences in associations between mental health and education.